Hi, everybody. Don't start time. Yeah, that's great. Thanks. We've all been in a waiting room at the doctor's office when we're given a form on a list, on a clipboard to fill out, and we're asked to list all of the prescription medications, the over-the-counter products, and the dietary supplements that we take. And it's at that moment you have one eye on the door, waiting and hoping that your name will be called next. And it's really hard then to remember all of the complete information, such as the exact product name, the full list of ingredients, and the correct dosage information. So we thought, also I wanted to mention that there is a potential for interactions between dietary supplements and prescription medications. So for that reason too, it's very important that healthcare providers know what dietary supplements you are taking. So we at the Office of Dietary Supplements thought that a mobile app would be a great way for patients to have a free mobile list of the dietary supplements that they are taking and to be able to easily share this list with their healthcare provider. Also, at ODS, our largest group of stakeholders is the consumer. So we are always looking for ways to increase our outreach to them. And I thought that this would be a really fun project, and that once this fun project got in the App Store, I could move on to other fun projects. So tonight I'm going to tell you about our app, and I'm going to share some of our lessons learned. Our app, called My Dietary Supplements, or MyDS, gives consumers a mobile list of the dietary supplements they take. They can then easily share that list with their healthcare providers. They can email it and print it out. It also provides reliable science-based information on dietary supplements. And it gives general information about our office. It basically serves as a PR tool for ODS. MyDS includes features such as the ability to track dietary supplement use for multiple people. It has an optional password protection program in it. In addition, the user can take up to 2 photos of a dietary supplement label. We can also collect usage analytics, and it also, we can change the content in the app remotely, so that we don't have to create and submit a new version of the app to the App Store every time there's a change in one of our fact sheets. However, we have run across a few roadblocks along the way. One of the biggest obstacles that we encountered early on was in setting up an Apple developer account for the Office of Dietary Supplements as an office within the federal government. Apple was not yet set up to receive requests from the federal government. And it took us about 2 months to even learn that Apple has a federal group here in town. So then we learned that, and our application was moved through the process. And based on our efforts and related requests, Apple is now much better able to handle submissions from the federal government. Another obstacle, during our development phase, Apple decided to go ahead and release a new mobile operating system, OS 4, and the iPhone 4. So know that there is a real challenge in working with and dealing with this ever-changing mobile landscape. Currently, we are working with the NIH Privacy Office and Security Office to be able to store data on our web server at NIH. And doing data storage for mobile apps is brand new for NIH, so we are supporting them as they work through this process. MyDS was successfully submitted to the Apple App Store on October 18th, 2010, and 9 days later, October 27th, it was accepted and became ready for sale, even though it's free. About 5 weeks later, version 1.1 became available, and that includes things like that remote content feature that I mentioned, as well as a version specifically designed for the iPad. Now, my take-home advice to you tonight is that developing an app can be a fun project, but it is not a project that is complete when it's in the App Store. Think of your app more like a website. It constantly needs to be maintained, revised, updated, supported, and promoted. In the very near future, ODS is planning to upload Spanish language versions of our fact sheets onto MyDS. And in response to the many, many inquiries that we have received, we are developing a web app version of MyDS that will work across all devices and desktop browsers. And that is our story in 5 minutes.